This portion of New Day Northwest is sponsored by Bellevue Pain Institute.
Monday marks the start of National Neuropathy Week. It's not a well-known condition, but 50 million Americans are suffering from peripheral neuropathy right now, and many more undiagnosed. The leading PN doctor in the Northwest is with us today to explain how technology, not pills, is revolutionizing the treatment for this debilitating condition. Please welcome Dr. Kevin Polzin of the Bellevue Pain Institute. Thanks for being with us.
Thanks for having me.
So many people we know are suffering from this, but what is peripheral neuropathy? I had not even heard of this before.
Well, if you have it, you know it. Peripheral means away from the center, away from the brain and spinal cord. Neuropathy means nerve damage or death. So we're talking about very, very small nerve fibers, nerve endings, that are subject to insult or injury, and in the presence of poor circulation can become necrotic and die. So these are nerves that send information from the body to the brain and back again. Commonly known as a glove and stocking disorder, the farther away from the brain and spinal cord it is, these are the ones that are most effective.
And so what is life like for someone who's suffering from peripheral neuropathy? Well,
their quality of life actually is very low, and the reason for that is that pain permeates every aspect of their existence. Their symptoms go on a continuum of starting with maybe cold feet and numbness and tingling, ramping up to pain and ache and burning and the feeling of maybe walking on feet filled with Novocaine.
Oh, wow.
And culminating in totally abnormal sensations of shards of glass cutting your feet, feet on fire type burning. Even the weight of a bed sheet is unbearable.
Oh my gosh.
Yeah, so they lose sleep. They lose balance, they're subject to falls, and because we're generally talking about an elderly population, sometimes these falls can be fatal.
Wow, and so how does somebody get this in the first place?
Well, once again, we're talking about very, very small nerve endings. So there's quite a host of possible causes, but most commonly diabetes. The glucose spikes in diabetes can cause neuropathy. 50% estimated suffer. People that have had subject to chemotherapy, 100% generally can suffer from neuropathy. Things that would impact the spinal cord itself, spinal stenosis, herniated bulging discs, and most interestingly, the most commonly prescribed drug in America, cholesterol medications or statin drugs, estimated 30% of people on statin drugs have neuropathy.
Oh, wow. Okay. So is there early detection for this, or is it, like you said, you know it when you got it, but there's no way to really know if you're at risk for it or heading that direction?
That's true, and the reason for that is we're not apt to go to the doctor when we're not hurting. So you don't go to the doctor and say, hey doc, can you make my feet hurt when I walk or stand too much, right? So what happens by the time you're already into the pain portion is when you enter the medical community. Your primary doctor would likely recommend some pain medication, refer you to a neurologist or podiatrist, where you're again offered more medication, and when that doesn't work, you're just told to live with it.
And you're saying there's an alternative to that?
Yeah, there is.
What is that?
Well, first of all, we comprehensively diagnose the nerves in the legs, the feet, and the toes. Unlike other evaluations, we're less interested in the cause of the damage and more to the extent and character of the small fiber nerve involvement. So if the examination does in fact reveal neuropathy, then a very specific protocol that is laid out to rehabilitate and regenerate these small nerves and restore function and decrease discomfort.
Not using pills?
Not using pills. In fact, we use literally hundreds of infrared and low-level light diodes that bathe the tissue in energy, saturating the tissue and improving the microcirculation and the fine motor nerves.
And so how successful has this treatment proven to be?
Well, the Bellevue Pain Institute is one of over 450 clinics worldwide in Europe, Canada, and United States of the Neuropathy Treatment Centers of America. This is a 501c3 nonprofit whose mission is to rid the world of neuropathy. So nationwide we did a study, and over 90% of patients are completely satisfied with our protocols. At Bellevue Pain Institute, we're very careful to only accept people that we can help, and we're doing so every day.
And I believe that one of those people is actually in the audience right now, Carrie Richter. We see you there. So you experienced a lot of what the doctor has described to us.
Correct, I have.
What has it been like for you living with that pain prior to treatment?
Prior to treatment, I was starting my day off with Vicodin all the time. I've been off the Vicodin for about 2 weeks now where I haven't had to use it. So it's helped me out considerably.
And do you feel like a new man yet, or you're sort of
Well,
midway through the treatment?
Getting there.
When you saw what they did, initially were you thinking, oh, I don't know if that's going to work, and then they turned you around?
You know, I was in so much pain, I was going to try anything to get out of it.
Yeah, yeah.
I mean, it was hard for me to make it through a day because I was having so much pain.
Yeah, well, I'm glad that it's working for you. So how does this treatment then progress? Carrie has just begun, so how long does this take, and at what point do people typically start to see a big difference?
Well, it's really quite fascinating that within the first several treatments, sometimes less than 6, 7 treatments, they're like, wow, I believe this is working. At about the 10-session mark, we do a comprehensive reevaluation and compare the initial evaluation to that to really document objectively the improvement. And most people are done in a couple of months.
And physically, you can see a difference. I think we have a graphic to bring up. We should mention that it's a little hard to look at the before and after, but you can definitely see a difference. That there's a physical difference. It's not just a feeling inside of your body, but there's a physical manifestation of the change.
Absolutely, and most quickly we see a decrease in the swelling. Many people have such poor circulation that the swelling pools in their feet, and right away that's one of the things that we certainly see.
And we were talking beforehand that epilepsy drugs are commonly used to treat peripheral neuropathy?
Well, there's a small family: gabapentin, Neurontin, Lyrica, Topamax. These are all seizure medications. But you know what they're also very good at is blocking pain reception in the brain. So much like this Lego block fits perfectly in the one above, it fills the pain receptor sites in your brain so you feel better. However, the epileptic medication, of course, doesn't cure the foot. You know, it would be pretty much similar to, well, how would it be if your cancer medication or the treatment for cancer was simply that you took a drug that removed your awareness of the drug or of the disease, and yet the disease was still left to ravage your body? You know, the fact of the matter is the drugs given for peripheral neuropathy really haven't changed in over 15 years.
Well, it sounds like you're making great progress. Thank you for being here to tell us all about it. And anyone looking for answers about neuropathy pain should know that this new therapy can be helpful. As we've mentioned, the treatment's non-invasive, painless, and there are no drugs involved. If you have questions, you can visit the Bellevue Pain Institute's website and click on their Ask the Doctor button, and Dr. Polzin will actually respond by video or email with your answer. As an added bonus, Bellevue Pain Institute offers first-time patients a free consultation with the doctor. We have a link to their site on ours. And next month, Dr. Polzin will be back to answer some more of your questions. We'll be right back with comedian Ian Edwards, so stay with us.